we are aware that some emergency physicians in university centers have been vaccinated, but we are equally aware that there's a significant number of community emergency physicians and rural emergency physicians who've not even been notified as to when that might possibly happen.
They've been on the front lines of Canada's COVID fight, but emergency physicians say many of them haven't even heard when they'll get the COVID-19 vaccine. Dr. Alan Drummond practices just 30 minutes outside of Ottawa, but he's not even heard when he might get his jab, while doses in some major cities are now going to non-frontline health workers.
There have been physicians that are not on the front lines, that are not even in the secondary or tertiary lines. People like psychiatrists who are doing Zoom meetings, people on maternity leave who have been vaccinated, who will not see a COVID patient likely in their lifetime. And yet emergency physicians actively seeing COVID patients, both in small communities and large, are still waiting for some semblance of information.
Drummond says it was bad enough seeing politicians and hospital administrators vacationing abroad over the holidays, but he says the lack of information given to emergency workers is completely unethical. Drummond points to social media posts made by non-frontline hospital staff showing off their vaccine shots and says colleagues have told him of hospitals choosing to vaccinate non-essential workers in order to use up their entire allotments.
They have coined us as healthcare heroes. Nobody feels like a hero. And certainly with this sort of attitude about information about the vaccination process, we actually feel kind of like cannon fodder.
The federal government announcing Canada will soon see a huge increase in vaccine deliveries.
The quantity of doses arriving in Canada is anticipated to average more than 1 million doses a week for both currently approved vaccines, starting in April.
Major General Danny Fortin says he knows supply has been a worry for the provinces and territories, but he says bigger deliveries are on the way.
We have limited quantities. We'll have a significant, big jump in the second quarter, and we'll be able to distribute much larger quantities and vaccinate at scale.
But Drummond says all he and other emergency medical staff want is information on when they'll get the shot.
If we were all told, oh, you're going to get, vaccinated by March, good, then we know, and we can, plan accordingly. But there's been a complete lack of respect. There's been a complete lack of acknowledgement for our commitment and sacrifice over the last 10 or 11 months.
In Ottawa, Xiaoli Li, City News.